Hello and welcome to this edition of Safe and Sound. I'm Bob Watts. February already. Before long we'll be looking back at a Midwest winter and looking forward to a hopefully beautiful Midwest spring. February is one of my favorite months for two reasons. One, usually after the 15th, the chance for nasty winter weather is gone. And two, I hear those beautiful words, pitchers and catchers report to spring training. Well, okay, we do have some helpful information to pass on to you today. We'll be visiting with Ameren UE and talking about energy efficiency. We will also speak with Theresa Williams from the Pet Adoption Center about spaying and neutering your pet. And we also have information on Dental Health Month for your pet. Later we will have in studio an expert to tell us about folic acid. But first, many of us have someone who we are close to that has been diagnosed with Alzheimer's disease. Joining me is Megan Herman, Outreach Coordinator with the Alzheimer's Association St. Louis Chapter, and we're going to talk about Alzheimer's awareness. Megan, thanks for coming in.
Yeah, thanks for having me.
Megan, Alzheimer's touches many of us. Can you start by giving us just a little explanation of what Alzheimer's is?
Sure. So yes, Alzheimer's disease does affect many people, and there's about 110,000 people here in Missouri that have Alzheimer's disease. So what Alzheimer's is it's a progressive neurological disorder. It's the most common type of dementia. So the term dementia is a broad term that describes a group of diseases that cause change in our memory and thinking. And Alzheimer's disease accounts for about 70% of those dementias that are out there.
Now, is Alzheimer's something you're born with?
No, Alzheimer's disease is something that you develop oftentimes in later years of your life. The most common type of dementia, what we call later onset Alzheimer's or normal onset Alzheimer's, is a disease that affects those who are age 65 and over. However, there are people who are under age 65 who have what we call younger onset Alzheimer's disease, people in their 40s and 50s when they develop this disease.
Now, are there some early signs of Alzheimer's, or what are the early signs of Alzheimer's?
Yeah, so the Alzheimer's Association maintains a list of what we call our 10 warning signs, things to look out for when you're worried about yourself or someone you love. And some of the most common things that we tell individuals to look for is changes in memory, so it might be forgetting important dates or having trouble balancing your checkbook, losing things. We all lose things from time to time, but when you start losing your keys in the freezer, it might be a warning sign. So little things like that are out of the ordinary for the person would be considered warning signs for the disease.
Now, how is it diagnosed?
Yeah, so the only true way to diagnose Alzheimer's disease at this time is by seeing a physician who has experience with Alzheimer's disease. There's unfortunately not a quick way, a quick blood draw or anything like that. So it's usually a pretty long process of a lot of question and answer, a lot of looking at the patient's history. And we always recommend that when seeking a diagnosis that the individual bring somebody who knows them very well with them to that doctor's appointment so that they can report on any memory changes that they've seen and that sort of thing.
Is there a treatment?
We don't currently have an effective way to stop or slow the disease, but we do have some medications that can help with the symptoms of Alzheimer's disease. And those medications do help when started earlier, which is why it's very important for a person to seek out that early diagnosis so they can get the help that is available.
If this is an appropriate question, I'm kind of an objective kind of person, with being a paramedic with heart rate, and do they have blood pressures, the heart beating, are they breathing? How does one die from Alzheimer's?
Sure. So people do die from Alzheimer's, which is a common misconception. It is currently the 6th leading cause of death in the United States. And as I had stated earlier, it is a progressive disease, meaning it gets worse over time. So it starts with those early warning signs, a little bit of forgetfulness, trouble with problem solving. But as the disease progresses, the person experiences more and more brain damage from the disease. So they will go into a point in time where they will have difficulty with communication, have difficulty with a lot of other body functions as well, because our brain controls everything our body does. And eventually, as the disease progresses, it's going to affect those parts of our brain that control our ability to breathe, our ability to swallow, and those things that are imperative for us to live.
And what does your organization do with the...
So I'm with the Alzheimer's Association, and the Alzheimer's Association is the world's leader in care and support for those affected by Alzheimer's, and also the world's leader in funding research for Alzheimer's. The Alzheimer's Association funds is the second largest funder of Alzheimer's research in the United States beyond the federal government.
And it does. There's a lot of research being done for this.
Yes, there's tons of research being done on Alzheimer's. St. Louis actually is essentially an international hub for Alzheimer's research. At Washington University, they're doing some top-notch research to find some preventatives and cures for this disease.
Now, how is your organization funded?
Our organization is funded in a lot of different ways, but most of our funding comes from individual donors. And the Alzheimer's Association does a lot of fundraising events throughout the year, including our Walk to End Alzheimer's that we do throughout our 38-county area in September every year.
Now, is a person that's diagnosed with Alzheimer's, do they just come to you, or are they referred by a physician? Or?
Yeah, so anybody can contact us at any time. We are available 24 hours a day, 7 days a week on our helpline at 800-272-3900. They can also go onto the web at alz.org/STL to learn more about the disease and find ways to get in touch with us. But we recommend people reach out to us at any point when whether it's they're concerned about the disease, or if they've been recently diagnosed, or if they have a loved one that they're caring for. Professionals can reach out and contact us as well if they're working with folks with Alzheimer's disease.
Is there any cost for the patient to come to you?
Most of our programs are offered free of charge, and we want to make sure that we can help anybody at any time when they're dealing with this disease.
Megan, anything else you'd like to add on your organization?
Just to make sure that if you're dealing with Alzheimer's disease, that you're not trying to do it alone. You can reach out at any point in time, like I said, 800-272-3900, and get some assistance so that you don't have to be alone on this journey.
Megan, thank you for coming in.
Thank you for having me.
We'll be right back.
For those dealing with the struggles of caring for a loved one, we hear you. Visit aarp.org/caregiving for advice and support.
Welcome back. Folic acid. Do you know what it is? I had heard of it, but when asked for a definition, I really didn't know anything about it. Joining me now is nutritionist Fran Moody, and she knows about folic acid, and we will too in a few moments. Fran, thanks for being here.
It's good to be here, Bob.
Okay, Fran, what is folic acid?
Folic acid is one of 12 B vitamins, and it is essential in our diet. Typically, a diet high in folic acid can prevent certain chronic diseases, and a diet low in folic acid can prevent anemia and also a reduced capacity to carry oxygen to our muscles. Folic acid is found abundantly in our diet and is also referred to as folate.
Where is it found in our diet, naturally?
Naturally, it's found in a lot of fruits and vegetables, such as citrus fruits, dark green leafy vegetables like spinach, kale, and broccoli, and also beans. It's also enriched in a lot of our grains like whole wheat bread, whole wheat tortillas, brown rice, pasta, and flour.
We all get folic acid, like you said, naturally. What part of our population should be concerned about the folic acid intake?
It is most important for women of childbearing age, and the reason for that is because statistically about half of all pregnancies are unplanned. And folic acid is really important for the formation of the brain and spinal cord of the infant. This process takes place very early on in the pregnancy, so for some women, by the time they learn that they are pregnant, the brain and spine of the baby have already been formed, which can put that baby at risk for certain birth defects called neural tube defects.
Is there a way someone could monitor the folic acid other than making sure their diet contains enough of it?
Yes, you can. For women who are trying to get pregnant, they can take prenatal vitamins, which usually have, which they will have folic acid in it. And especially if it's prescribed by the doctor, that would be a good source of folic acid for them.
Now, can folic acid be purchased as itself if someone needs to know that they need to bring the levels up?
Yes, you can buy a B vitamin complex. It's sold at any kind of store, and that will have some folic acid in it.
Is there any danger of getting too much folic acid?
Not really. It is a water-soluble vitamin, which means our body gets rid of it through going to the bathroom, and it does not create toxicity in our bodies.
So a woman of childbearing age needs to make sure that she is on a diet that contains the recommended daily amount, or is like they always say with vitamins and that?
Well, pregnant women need a little bit more. The typical person needs about 400 micrograms of folic acid a day. Pregnant women need more like 600 micrograms a day, and breastfeeding women need about 500 micrograms per day.
Fran, what specific birth defects can be related to folic acid shortage?
It can cause certain birth defects called neural tube defects. Neural tube defects are a result of incomplete closing of the backbone or the brain and spinal cord. The most common one is spina bifida, which can result in a small sac that sticks out of the backside of the baby.
So all women of childbearing age can meet the daily requirement by, let's say, a prenatal vitamin?
Well, yes and no. If the woman is taking the prenatal vitamin in the very early stages of being pregnant, then yes, that would be the requirement. But very often women start taking the prenatal after their first month of pregnancy, and by that time it's too late to make a difference.
So it is very important to get prenatal care, and the earlier the better.
Exactly.
If you're not sure this applies to you, who should the woman be talking to?
You can consult your doctor, and they'll be able to tell you whether you need more folic acid in your diet, and if you're planning to get pregnant, they can prescribe you certain prenatal vitamins. You can also just eat more fruits and vegetables, beans, all of the foods that we talked about that can really help to get more folic acid in your diet.
Fran, where can someone get some additional information or learn more about folic acid?
You can look on national organization websites such as the National Council on Folic Acid, March of Dimes, or the National Institute of Health. You can talk to your healthcare provider, or if you qualify, meaning underserved infants, children, or pregnant or breastfeeding women, you can get in contact with the St. Charles County WIC program. They have dietitians on staff there who do nutrition counseling and can also provide information on folic acid. And if you'd like to learn more, anyone that would like to learn more can visit our website at www.scchealth.org.
Fran, thanks for the important information.
Thank you, Bob.
Let's go now to Dan Laurent, Director of Energy Efficiency at Ameren, Missouri, and talk about energy efficiency.
Energy efficiency is a simple concept, and it's all about using a product or technology to use less energy without sacrificing quality or performance. Ameren, Missouri wants to meet our customers' needs in a safe, reliable, efficient, and environmentally responsible manner. And so we have just rolled out early in January a new portfolio of about $150 million investment in energy efficiency programs. Those programs are designed to save customers 800 million kilowatt hours on energy savings per year. That may sound like a big number, and it really is a big number. It's a huge number. In fact, our analysis shows that 800 million kilowatt hours is the equivalent annual usage of about 60,000 average homes on our system. Customers can be more energy efficient in the home by visiting our website, actonenergy.com. On our website, we have a wealth of information about energy saving ideas with our programs that we have. We just rolled out a $150 million portfolio of energy efficiency programs that will be in the marketplace over the next 3 years. We have programs designed for residential customers and business customers. And there's just a wealth of information out there. It's a great opportunity for customers to view the information and find out what energy saving opportunities and incentives are right for them. We encourage customers to go to our website, actonenergy.com, and when they visit the website, the first thing they'll see is they'll have to choose between Missouri and Illinois. When they choose Missouri, they'll get an option to choose between for my home or for my business. Once they decide which program they want to know more information about, they simply click on that. It provides more information about the incentives. For example, on our refrigerator recycling or appliance savers program, they'll be able to find out how they can work with us to schedule an appointment for us to come to their home to pick up their old working refrigerator or freezer. There's a lot of different ways customers can be more energy efficient in their home. They range from doing simple things like replacing lighting. So you can replace the old incandescent bulbs with compact fluorescent bulbs or LED bulbs, light emitting diodes, and you can save up to 75% on the energy cost just by replacing the lighting. You can also do things like we incent customers to allow us to come to their home and recycle an old working refrigerator or freezer. So what we do is we come in, we give the customer a $50 incentive, we pick up the old working refrigerator or freezer and any working window air conditioning units or dehumidifiers in their home. We completely recycle that unit. So we disable it as soon as we leave the customer's home. We recycle every component. Like I said, the customer gets two benefits. They get the incentive up front, $50, and they also get long-term energy savings. An old, inefficient refrigerator can use about $100 worth of energy on an annual basis. There's a lot of information on actonenergy.com website for business customers also. The way we do things with business customers, we list the opportunities by business type, so say by grocery or retail or business or industry, and we also list it by type of technology like lighting, refrigeration, that type of thing. So we've got a whole portfolio of programs for business customers that they can explore to find the situation or the incentive or program that's right for them. What we'll also do is we have a custom program. And if there are energy saving opportunities that customers see that they don't find on our website, we encourage them to call us and we'll work with them. And if we can find a cost-effective way to provide an incentive for them to be more efficient, we'll do that. Ameren Missouri provides incentives for customers to purchase more energy-efficient lighting. We provide instant rebates at a lot of retail stores throughout our service territory. And we not only work with the big box stores, we work with the club stores, we work with the drug stores, we work with the dollar stores, and we incent more energy efficient lighting. Since we incent the purchase of compact fluorescent bulbs, we also provide recycling locations at more than 100 retailers and communities across our service territory. And so if customers visit our Act on Energy website, they can click on CFL Recycling and find the recycling center that's most convenient for them. So in addition to working with customers to provide for their needs in a safe, reliable way, we're very interested with our new portfolio of Act on Energy programs to helping customers be more proactive in managing their energy use. There's a couple different ways that customers can get started. One, they can go to our website, actonenergy.com, and look for information there. If they don't find the information that they're looking for there, they can also call our contact center. The number is 866-422-4605, and the hours of operation for that number are 7 a.m. to 5:30 p.m. Monday through Friday.
Thanks, Dan. We'll be right back.
Traditional light bulbs actually generate 9 times more heat than light. Switch to energy-saving bulbs. Saving energy saves you money.
Welcome back. Responsible pet ownership starts with having your pet spayed or neutered. Theresa Williams from the St. Charles County Pet Adoption Center will tell us about it.
Spaying and neutering your pet is very, very important. It not only reduces the pet overpopulation problem that we have in the entire country right now, but also it decreases certain health risks for your pet. When you spay a female pet, then it literally eliminates all the possibility of getting any kind of breast cancer. When you neuter a male dog, then you can drastically reduce some types of cancers and some types of tumors and certain types of hernias that they get when they are not neutered. So it not only is a benefit health-wise for the animal, but it also is a benefit for the entire community. The myth that if you spay or neuter your pet that the dog or cat gets fat and lazy is completely a myth. It's just simply not true. Extensive research has shown that when you spay a female, there is absolutely no correlation between an animal's weight gain and spaying a female dog or cat. However, if you neuter a male dog, there has been some studies that have shown that male dogs can have a change in metabolism after they're neutered, and so that can result in some weight gain if you continue to feed your dog too much and if you don't let your dog exercise enough. So when you have a male dog that you've neutered, and you should neuter them at a certain stage in their life so that when they're younger, then you just need to make sure that they're up on their exercise, make sure that you have toys and let them play, get them outside and walk them, and just make sure that they're normal, active dogs, and you shouldn't have any problem. And of course, don't overfeed your dog, because that's the reason that we see so many obese dogs and cats, is because people just tend to overfeed them. Spaying and neutering can be done at any time in an animal's life. Now, well, I shouldn't say any time. We don't spay and neuter our animals for adoption until they're over 8 weeks of age. But we're an animal shelter, and at animal shelters, we don't take the risk of allowing animals to go back out into the community that are not spayed and neutered. And it's perfectly safe procedure for young animals to be spayed and neutered. Most veterinarians will tell you that the ideal age to spay and neuter a dog or a cat is between 4 and 6 months.
For a female dog or cat, it's very important that they get spayed before their first heat, because after that, every time they go into heat, it increases certain types of cancers to, it's more likely that they will get certain types of cancers for every time that they go into heat. So it's very important, especially for a female, to get that done before the first heat cycle, which in most dogs is going to be about 5 or 6 months, and cats as well. Cats can be done, cats can go into heat a little bit earlier than dogs can sometimes, so you have to be very careful. If you do have a pet that you don't get a pet as a puppy, for instance, you get an animal from a friend that gives you an animal, or you get an animal off Craigslist, or some other way that you get a pet, and it's already an adult dog or cat, then you can get that animal spayed at any time in their life. You can even get older animals spayed or neutered at any time, as long as your veterinarian thinks that it's okay to go ahead with that procedure. It doesn't change the animal's personality, and it's not harmful for the animal to be spayed or neutered. In fact, it is indeed healthier for an animal to be spayed and neutered at almost any stage in their lives. Animals do live an average of 2, maybe 3 years longer, and they live healthier lives when they're spayed and neutered. So if you do get a pet that's already full grown, don't hesitate to take it to a veterinarian and have it spayed or neutered. Spaying and neutering is a very safe procedure now because our veterinarians are so qualified. They have such wonderful equipment, and of course they're all very well trained, and they certainly know what they're doing. It's I shouldn't say a very simple procedure, but it's something that is done very, very commonly, and therefore it's considered a safe procedure. However, there's always risk at any time there's a medical procedure. There's always a possibility that an animal can have a reaction to anesthesia, or something can go wrong once an animal is under anesthesia. So there's always that possibility, but the possibilities are very, very slight. And in fact, you have more of a risk of your dog getting hit by a car than you do of dying on the table because of a spay-neuter procedure. The Pet Adoption Center has a low-cost spay and neuter program, and if you qualify for the WIC program, then you'll qualify for our low-cost spay and neuter program. The cost of the program is $55 for a dog, $30 for a cat, and that includes the rabies shot. However, if you don't have a tag, and if you would like a microchip, then you can pay $5 extra for a tag and $10 for a microchip. But you can get a microchip at the shelter anytime we're open. You don't have to have an appointment. You can bring in any pet to get a microchip. If you have any questions about adoptions, then you can please visit us on petfinder.com or petharbor.com, and you can see the animals that we have available for adoption. You're welcome to call the shelter at 636-949-7387 and ask any of our helpful employees about any information on any of the animals available for adoption at the shelter. And you can also get information about our low-cost spay and neuter program also at that same phone number.
Thanks, Theresa. Did you know that February is National Pet Dental Health Month? Here is veterinarian for St. Charles County Humane Services, Dr. Robert McCool, to tell us how you can keep your pet's teeth healthy.
We're going to show you a couple of patients today to demonstrate teeth problems in pets and why it's important to take care of your pet's teeth. This is because we're heading into this month of dental health care, which is February of every year, to make people more aware of how important it is to take care of their pet's teeth. So first we have our first patient here, and before I show you the teeth here, I want to go through the what happens with teeth and how it's very, very similar to our teeth. Number one, when dogs get tartar on their teeth. Now tartar is same thing as plaque. It's this little mineral deposits that look kind of brownish on the surface of the tooth. When they get on the teeth, that tartar eventually gets up under the gums and causes gingivitis, inflammation of the gums, and eventually infection in the gums. Once we get infection in the gums, the tooth attachment, what we call the periodontal ligament, which attaches the tooth to the bone, becomes damaged, and then dogs will lose their teeth prematurely. Bad teeth also can lead to other problems, though. Besides loose teeth and toothaches, which is a big problem, once the bone is infected, there's going to be pain associated with that. But one of the more important things that we've learned over the years is that bad teeth, infected gums, gets into their bloodstream and can damage their heart, their kidneys, and their other internal organs. So it's more than just making their teeth look pretty and their breath smell good. Taking care of the teeth also helps keep your dog alive longer and keep them more comfortable. So that's why it's become a big thing, and that's why February is now the teeth awareness, dental healthcare awareness month for pet owners. So let me show you first here. We have our first very friendly, a little bit scared patient. And what I'm going to do is just kind of see if we can show you the teeth from the side. Now, you'll notice on these teeth, these are pretty normal. We only have a very small amount of yellow discoloration on them, but otherwise they're very white. The gums look real healthy. You'll see a difference when we compare them to our next patient. They're nice and pink. There's no red spots on the gum. Okay, something most of us could just look at home. You don't need a degree to be able to tell whether there's something real obvious with your pet's teeth. Okay, so this is Marge, our second patient. And what I'm going to do is show you with Marge how our teeth look. So if I pull back the gums here, now first of all, you'll notice, if you can kind of remember what the last ones looked like, there was more pink. Now we see a lot more red here, so we're starting to get gingivitis. You see the yellow on this tooth, all of them have little bits of yellow on there. I can even take my finger and I can probably break off a piece. So here's a piece of tartar that actually came off from the tooth to give you an idea what it looks like. So then when I do that, you see what the tooth is supposed to look like underneath. So that is the next stage of what happens to the teeth if they're not cleaned at this point. Now at this point, all the teeth they're solid, they're in place, they're not loose yet. So the ligament that attaches the tooth hasn't been damaged yet, but we do have gingivitis. Okay, so here is our next patient. This next patient is, we'll just call her Cutie. We don't have a name for her yet. So to show you her teeth, she's not quite as happy about us touching, but this gives you an idea of what the next stage is. Okay, so in this stage, you can see that we've got a lot of tartar right where my finger is here, a lot of tartar on this tooth, a lot of tartar on this tooth, a lot of tartar on this tooth. The other thing is, you notice there's only 3 teeth visible right here, but it's because we've already lost a couple of the teeth. So we've already entered the next stage where some of the teeth have gotten infected, they've fallen out. And the question is, by then, we've already have damage to the kidneys and the liver and the heart from infection that would have gotten into the bloodstream. Because one of the things that happens is when the gums have really good blood supply, and that's why an infection in the gums has more chance of getting into the bloodstream than an infection, say, from a cut or something else on the skin. It's because of the blood supply here. So this is the next stage. And then after this stage, what will happen is eventually all the teeth will fall out. So this dog is actually overdue for a teeth cleaning. We're past the point at which it's ideal to, we want to clean those teeth before they lose the teeth, not once the teeth are already falling out. All right, and here is our last patient, Casey. Now, Casey is to the point of no return, okay? I'm just showing you Casey just to show you, once the teeth have gotten really badly infected, you're left with no teeth. So Casey actually has no teeth at all. However, when you look at the gums, they're not nearly as red and inflamed as the other 2 dogs that we looked at, which tells us, that's okay, Casey. It tells us that even though Casey has no teeth, she's actually in a lot better condition at this point than those 2 previous dogs. The 2 previous dogs over time have had toothaches, have had infection in the gums, and when that happens, since the teeth were not taken care of, there's going to be potential for shortening of their life from bad heart or bad kidneys as the dogs get older. So in this case, this dog's teeth were pulled because they were infected, and even though most people would think it's bad to not have any teeth, what are they going to eat? Dogs without teeth can eat canned food very well, and as a matter of fact, many of them can eat dry food. They just learn to gum it, and they still eat dry food, which is a surprise to most people. It certainly does not decrease their quality of life. As a matter of fact, now that they're pain-free and feeling good, these dogs live great lives. So there's nothing wrong with no teeth. Ideally, we would all like our pets to have their teeth, though. But the only way that's going to happen is if we stay up on having them cleaned. And then the other thing you can do is brush the teeth.
Thank you, Dr. McCool. That's all the time we have for today. Please join us next time for some more information to help keep you safe and sound.